Influenza, or the flu, is something we've come to dread every year, but it's not something people seem to take too seriously. Most folks will receive a vaccine or will do what they can to avoid being around people with the flu, and maybe endure flu season with a slight respiratory infection. However, the Centers for Disease Control and Prevention estimates that the flu contributes to the death of about 3,600 people on the average each year. So this is truly a very dangerous illness, particularly for those 65 years of age and older, and for the very young, around 5 years of age or younger. This is why the medical community, from the CDC down to local primary care physician, take great pains each year to ensure that high-risk populations, such as the elderly, are vaccinated against the flu. Occasionally, we face a very serious pandemic flu. The 1918 pandemic resulted in the deaths of more than 650,000 Americans and claimed the lives of more than 50 million people worldwide. The 1968 pandemic contributed to more than 34,000 American deaths and more than 700,000 deaths worldwide. These are viruses that are able to move very quickly and cause severe symptoms that significantly increase mortality rates. And right now, we're tracking the possible development of a pandemic flu. A pandemic is basically a global disease outbreak. We've seen this recently with the severe acute respiratory syndrome known as SARS, where respiratory infection swept through Eastern Asia a few years ago. Similarly, an influenza pandemic occurs when a new influenza virus emerges for which there is no immunity in the human population. This virus begins to cause serious illness and spreads from person to person worldwide.
At this time, we are most concerned about a strain of flu called H5N1, commonly referred to as avian influenza or the bird flu. Since 2003, a growing number of H5N1 cases in humans have been discovered in Asia, Europe, and Africa. This is a virus that is carried by migratory birds. Birds will often carry this virus in their intestines, and usually they do not get sick from the virus. These birds are very contagious to other birds and can spread the virus easily through their saliva, nasal secretions, and through their feces. The risk of contracting avian influenza is generally quite low because the viruses do not usually infect humans. However, H5N1 is one of only a few avian influenza viruses that can infect humans, and it is the most deadly of those viruses to have crossed from bird to human. Those cases of avian flu that we've seen develop in humans have mostly been cases where people lived in very close proximity to birds who carried the H5N1 virus, and it has thus far been found to be transferred from bird to human only, and not from person to person. A major concern with H5N1, however, is that like all influenza viruses, it has the ability to change, to adapt, and might eventually be able to spread from human to human. This is a virus that in humans is particularly harmful. More than half of the humans who have contracted this flu have died, and not due to a lack of medical care. Often when this virus has been diagnosed, these patients have received very good care for their condition and were still found to expire from their ailments. So far, some of the individuals who have contracted H5N1 have exhibited common flu-like symptoms such as fever, muscle aches, sore throat, and coughing. Others have developed life-threatening pneumonia, severe respiratory infections, and other dangerous complications. This is a very serious risk, and we must be prepared to deal with it should the virus change into a form that can move easily from person to person.
A pandemic may involve anywhere from 15 to 50% of the population. In a community of 100,000 residents, something slightly smaller than the population of Carroll County, we would be looking at least 15,000 people suffering from a very acute illness. These individuals would not be mildly ill, but seriously sick and in need of medical attention.